That's the sound of the 1951 Ford Victoria Hot Rod, fully restored and donated from the private collection of A.J. Hires. It's the 2017 Win the Classic Ford Car Raffle to support Helping Seniors of Brevard. You have to see this car. I'm Kerry Fink, and I'm inviting you to visit helpingseniors.brevard.org for full information on this exciting car raffle. That's helpingseniors.brevard.org. Stay tuned for more info on the Talk to Me radio network. We're glad that WMEL cares about the space and Treasure Coast.
The views expressed on the following program are those of the hosts, callers, and guests, and are not necessarily those of WMEL staff, management, or advertisers.
Hi, welcome to Helping Seniors of Brevard, the radio arm of Helping Seniors of Brevard Incorporated. My name is Kay Kaiser. I'm the information specialist, and I'm sitting in for our famous Joe Steckler, our president, founder, who is actually doing some videotaping for some new television shows, I should say, today. So I welcome you to the program. We've got some very interesting guests joining us in the studio today. But before I introduce our special guest, I'd like to put a special thank you out to those who support us. I'm not going to be able to get through the whole list in the first half of the program, so we'll pick it up on the second. But people that help us, for example, Aldea Today, Autumn House, Barbara McIntyre, who specializes in reverse mortgage funding, Barefoot Bay Tatler, Brevard Chiropractic and Injury Center, Canadian Meds of Melbourne, Care Patrol, Courtney and Braswell Financial Group, Ebony News Today, Ear Care, Handy Pro the Space Coast, Hibiscus Court, Hometown News, and above all here, our special WMEL supports us every week with our radio programs. So thank you, John Harbour and your team. We appreciate you allowing us to get the information out, which is basically what Helping Seniors is all about. Our mission is to educate, inform, and connect our senior callers and caretakers to resources that they may be looking for. I find that a lot of seniors, they just say, well, I don't have a computer. I don't know where to turn. Yet many, and unfortunately, wait until it's a crisis situation. And I think, oh, if only you would have called me 6 months ago, we could have helped you. But so I do my very best to try to get people connected to the available resources that they're looking for. Oftentimes, I find when a caller calls, they may be calling about one specific thing that they're looking for, but it particularly is important because a lot of times I'll get a senior spouse. She is unmarried. She's a widow of a veteran, and she had no idea. She's on a very low income that she may have available to her what's called the VA Aid and Attendance Program. Okay. So I think, ladies, we'll be talking maybe perhaps about that as well. So it opens up because when I get a call, as the information specialist, I try to develop a relationship with them. You're not going to call, when you call our number at 473-7770, that's area code 321, you're not going to get a prompt. You're going to get me. And if I'm on the other line, which often I am, I encourage our callers to leave a message because I always return the call back. So our number to reach me at Helping Seniors of Brevard is area code 321-473-7770. So without further ado, we've got some interesting guests in the studio and something that's relatively new in Brevard County. So with further ado, I'd like to welcome to our radio today Betty, is it Berrisford? Am I pronouncing that correct?
Yes, ma'am.
And Carol Knouse?
Correct.
Both of the ladies are involved with a relatively new home care service called Avid Home Care Services. But what caught my eye about picking up the phone and introducing them to Helping Seniors of Brevard is that unlike a lot of different healthcare agencies and so forth, I've learned that they have absolutely no minimum. Carol, why don't you comment on that?
Sure. That's something, when we were looking to start the agency, we did a lot of research into the trends, not just in our area, but all over the country. And we especially looked at the possibility of purchasing a franchise or
Right.
opening our own business. And when we looked at the franchises, we noticed that there were many restrictions, and we had to abide by their corporate guidelines and things
Right.
of that, because there are so many of those agencies out there. And
Right.
we decided that in our true passion and interest to help people, and especially seniors, many of whom are on limited fixed incomes,
Right.
they need help, but they can't afford the minimum time frames that many of the agencies have, which are typically either 3 to 4 hours. And so we decided not to have a minimum. Now, obviously, in most cases, we're going to be someplace for an hour. If we have to
Sure.
help someone with a shower, it's going to be for an hour. But a senior does not have to pay for 4 hours of service just to get a shower.
Right. And that's important because you're right. Two things that I picked up on your comment here, Carol, is the fact that you said that most seniors are on a limit. Many are on a limited
Absolutely.
income, but yet they need help. And they may have family that live in another state. I mean, I've had callers. I can't tell you how many, from a daughter that says, "Well, I was visiting mom and she hasn't had a shower in a week."
Right.
And I thought,
That's
oh
right.
my, that's imagine how that's not aging with dignity.
It's not. And,
No.
what happens is, I think people, as they age, they get concerned about being by themselves and taking a shower.
Sure.
So even when we have one of our aides in someone's home, not necessarily do they have to actually physically assist someone with a shower, but be there just for safety's sake.
Absolutely.
But we do, of course, do that assistance, but people feel comfortable having someone in the home while they're there, showering, shampooing, whatever.
Absolutely. And if I'm not mistaken, most of the falls happen in a shower.
Absolutely. Absolutely.
So-
The bathrooms and kitchens are the two critical areas where
Yeah.
people mostly have problems.
Betty Berrisford, why don't you comment on that? What's been your experience in so far in finding what Carol has mentioned?
Well, that's apparently the main cause that people need help. And, having gone through a father with Alzheimer, I was very much aware of that and the need. And I think the average layperson is not aware of it and can't do anything about it because they don't know they need to do something about it for months, 6 months, 8 months. And that by that time, things are too late.
Right. I find a lot of the caretaker and family members that call, and they're just to find that their parents may be in denial.
That's right.
Yeah.
Absolutely.
Very much so, many times.
They say, well, I don't need any help. And then something
right.
happens and they fall. And now the daughter calls and said, can you find somebody to do some home modifications for me?
Yes.
We need grab bars. We need a ramp.
That's right.
Now they're getting ready to be released from rehab. Now we need somebody to come into the home who can help them out. So like you said, I picked up from you, Carol Knouse, the fact that, franchises definitely have strict regulations, and you decided not to go that route because you felt that with your experience and Betty's experience, the fact is that you formed an LLC, so that you mentioned prior to going on the air that you had done a lot of research on it, and you hired a consultant to go through all the rules and regulations in the state of Florida.
Right.
Why don't you elaborate on that a little
Sure.
bit?
As I mentioned, when we were doing our research, and we had pretty much nixed the idea of going with a franchise, we started to look for companies that do healthcare agency startups. And this particular one, and they're actually located in Florida, over on the West Coast, they specialize not just in Florida, but in all 50 states. So they have people that are knowledgeable of the rules and regulations in all 50 states. And
Oh, good.
Florida is one of the more difficult states to get licensed in because of all of their laws. It's a very strict review that has to take place. So
I'm sure.
the amount of policies and procedures and the things that we have to do on a regular basis to ensure that we're compliant is quite extensive, and we needed help to do that. We estimated that if we had done it ourselves, it probably would have taken us at least 2 to 3 years to get our agency started, and they helped us, and we were up and running in 4 months.
That's amazing. Well, let me ask you, Betty, why was Avid Home Care Services formed? Well, when you're doing all your research, I bet you found some interesting statistics right here in Brevard County, didn't you?
Yeah, well, I as I say, going back to my history, I always wanted to care for elderly people because I did way years back as a child.
Okay.
And then I came to realize around here, if you go to the store and you see all these people that are alone, barely navigating a cart,
Right.
with no one around them to help them unless somebody happens to walk by and they're in trouble.
You noticed that too?
Absolutely.
Oh, my goodness.
Absolutely. And it just became very, very apparent to me that there was a big need here.
Absolutely.
And it was something I wanted to try and fulfill.
Well, we actually have a group of volunteers and formed an advocacy council, and we did a great deal of research on and what's going on in Brevard, statistic-wise and so forth. And actually, if we go by AARP standards, it's 1 out of every 2 people.
Wow.
That are 50 and over. And I believe 1 out of every 4 are 64 or 65, if I'm not mistaken. So, and that's only going to grow.
That's
Absolutely.
Unfortunately, I should say this, but Brevard is no longer a big secret.
No,
It is not. It is not.
By
You've just
far.
witnessed the traffic that you see.
Oh my gosh, I've been here over 20 years, and I mean, just in Merritt Island alone,
Yes.
it was a pleasure coming down here. Oh, this is wonderful. I don't have to go on the interstate.
Yep.
I can just go from A to B, and
Sure.
and now it's like, woo. So it's happening all over. We are definitely blossoming, and the baby boomers have come into age. They're going to say, hey, let's go someplace that we find a relaxing atmosphere, kind of
Yes.
low key and all that, but
Yes.
and we're going to enjoy our retirement years. So
Yep.
I know, having worked with seniors for many, many years from a retirement home, the people would come down, especially to Cocoa Beach, et cetera, to the beaches that are from the Northeast or the Midwest, and say, they'd lease 6 months and go back. Well, guess what? They decided they just doggone well move here.
That's right. That's
right.
absolutely
That's
right.
Absolutely.
Well, my name is Kay Kaiser. I'm the information specialist, and I'm proud to be sitting in from Joe Steckler today, who typically hosts our program on the air Thursday on WMEL. And with me today is Betty Berrisford and Carol Knouse, and they formed a company called Avid Home Care Services. I know we give numbers out a lot, and I will say after you repeat your number, but let's get your telephone. How can people contact you?
Sure. Our number is area code 321 392 3400.
That's an easy number. Let's say that one more time.
It is area code 321 392 3400.
Okay. And I understand that your office actually is located in Merritt Island, but you serve all of Brevard County?
Yes, we do. We are actually licensed in 4 counties.
Wow.
We are licensed in Brevard, Orange, Osceola, and Seminole.
Wow.
But our focus is Brevard.
Okay.
Especially being a new organization, we're not going to spread our tentacles out too far. And we've basically been focusing in the central part of the county, since we're located in Merritt Island and the surrounding areas.
That's central.
But, yes. But ultimately, as we, as our reach grows, it would be all of Brevard.
Okay. So are you looking to hire home health aides or CNAs or anyone else at this point as you expand?
Absolutely.
Okay.
And we've done that. We have been staffing up, and we have been absolutely pleased with the employees that we've hired. And not only are we pleased with them, we hear from our clients every day how happy they are with them. So we've been
Fantastic.
very, very fortunate.
Well, let's talk a moment if we can. Betty Berrisford, I know. Let's come back to you on this question. You say you were in the medical field. Can you define that a little more clearly for us?
Yes, I'm an RN, and my husband was a physical therapist.
Okay.
And so I did, just out of school, I did private duty nursing for a while in New Jersey.
Okay.
Because I wasn't sure what I wanted to do. And then I met my husband, and I decided what I wanted to do. And so I joined his practice.
Uh-huh.
And
okay.
we enlarged to 3 offices, and I managed the offices and treated patients and did the bookkeeping, etc.
Wow, you
So
had your
that's-
hands full then.
Yes, indeed.
Definitely. So,
Yes.
so you understand having the nursing background. Are you the one that goes out? Do you do the assessment for potential clients, or
No, we have a wonderful RN who goes out and does our assessments,
Okay.
and she reports back to us
Uh-huh.
with a written report with her recommendations. She also communicates that to the patient or to the customer, so that there's not a shock when we call and say, she'll say, I'm going to tell the office this is what I think you need, and they'll be calling you.
Right.
And so we call them and set up an appointment with our aide or healthcare CNA.
Okay. Perfect. Well, let me ask you further. What services do you actually provide? I know I've seen both that there's a hands-on, which is medical, and there's a hands-off. So let's maybe start with a hands-off. What does that all entail?
We don't do actually hands-on medical.
Right.
We do, for example, if a patient is bedridden, if you have a patient with severe neuromuscular disease or whatever, we can roll them, we can turn them, we can get them in bed, out of bed.
Okay.
And that is hands-on.
Correct.
But we just do not do anything that is considered medical.
Medical.
Medications, we don't give medications. We'll get them for the patient, take them to them, make them available that it's time for the medications. But we don't physically give the medications.
Okay. That makes a big difference,
Yes.
too.
Yes.
And do your gals and guys that work with you, when somebody needs a shower, they have a shower seat, are they just monitoring the situation, or are they able to assist them in the bathing?
They do both, whatever they need.
Okay, perfect. And then
Whatever they need.
then I assume that they can help dress them?
Absolutely.
Okay.
Absolutely.
Okay.
And we have male nurses that go out for the male patients that we have contact us.
Good.
So, and we have wonderful, just really wonderful CNAs.
Wow, for a short time that you've been open, you're really rolling. You're in the right direction.
Yeah.
Going back to statistics, if I'm not mistaken, Brevard County, and you chose the right one, if I'm not mistaken, is the 24th oldest county in the
Wow.
country.
In the country, wow.
In the country, so
Wow.
it's only gonna get bigger. I think when the senior ages and so forth, they just say, I don't want to fight this traffic anymore.
Right.
Absolutely.
I know that
Absolutely.
a number of years ago when I moved from Dayton, Ohio into here, it was a totally different world. And, I thought, like I said earlier, it's not enjoyable to drive the interstate every day to work 40 minutes. No.
No, it's not.
No. And I get so many, now, let's say if somebody wants to, they need a trip to the grocery store. Now, that would be the flip side of the coin of a service that you may offer. Is that correct?
No, we totally available. It's a companion service.
A
that we
companion.
offer.
Let's define
Yes.
companionship.
Okay. Would you like to help me
Sure.
with that?
The companion service would be considered hands-off. So
Correct.
the personal care would be your hands-on, as we said, the bathing, grooming, dressing, assistance with ambulation or transfers, meaning moving someone from a bed to a wheelchair or whatever.
Right.
The companion side is all hands-off.
They cannot touch.
Correct.
If somebody needed help to get into the car, they could not offer a hand.
They put their arm out as support.
Yes.
Okay, that's the limitation, right.
But they cannot, physically do something for them. They cannot move them. They cannot lift them. Those kinds of things. So they
Right.
have to be able to ambulate themselves and take care of all of that kind of thing. But we take care of things like light housekeeping,
Okay.
laundry, errands, cooking, absolutely, meal
shopping.
shopping, meal prep, meal planning. errands, take them to the hairdresser, take them to doctor's appointments, and we utilize either their vehicle or the aide will utilize their own.
Okay.
And especially for those that may be in a chair or something, and if they have a special lift on their van, or it's more ideal for our employee to drive their vehicle. But so that would be the companion side of things.
Okay.
And,
that makes sense. And to reiterate, talking with Betty Berrisford and Carol Knouse of Avid Home Care Services, you have no minimum.
That is correct. That is correct.
So I want to get into a little bit more about the payment and what you accept in that second half here, if we may. But until that time, I think that many of the callers, are they coming from the central part of Brevard right now, or are they coming from all over?
They are actually, they have come from primarily the central part of Brevard, but we're starting to branch out. We had some advertising done in the Florida Today newspaper, as well as Merritt Island Now and some other things coming up. We are going to focus a little bit more toward the Titusville area because the northern part of the county is very underserved in terms of home care services.
Yeah, I'm glad you're going there because I find the same thing from callers.
Yeah, so the one thing that I wanted to mention also, and after the break, maybe we can get into this a little bit more, is respite care.
Absolutely.
And respite care is such a critical need for people who are family caregivers. And,
no kidding.
We can talk about that.
Yeah, who takes care of the caregiver?
Absolutely.
No one.
Absolutely.
No one. That's right. So they definitely need a break, and I think we need to definitely bring that up in our second part of the program here. We've got about a minute left before we take our initial break here. But my name is Kay Kaiser, sitting with Joe Steckler, our president-founder, who's normally our host of our Helping Seniors of Brevard radio arm. And today my guest is Betty Berrisford and Carol Knouse, who are with Avid Home Care Services. Now, they're located in Merritt Island, but they're branching out and serving all Brevard County. So they got my attention because they do both. They both do the hands-on, and they do the hands-off, and they require no contracts. So for those out there that are listening to the program saying, well, I can't afford anybody, I may only need an hour, you have a solution. So I want you to jot down their numbers, 321-392-3400. Is that correct?
Yes.
And if you didn't have a chance to get that, please call me, Kay Kaiser, at 321-473-7770. I keep track of everything, so stay with us. We've got some exciting more things to talk about in our second half, and I'm enjoying talking to both of these ladies, and I think they've got some incredible information that is going to make your listening time well worth it. So stay with us. We'll be right back.
That's the sound of the 1951 Ford Victoria Hot Rod, fully restored and donated from the private collection of A.J. Hires. It's the 2017 Win the Classic Ford car raffle to support Helping Seniors of Brevard. You have to see this car. I'm Kerry Fink, and I'm inviting you to visit helpingseniorsofbrevard.org for full information on this exciting car raffle. That's helpingseniorsofbrevard.org. Stay tuned for more info on the Talk to Me radio network. We're glad that WMEL cares about the space and Treasure Coast.
Hi, welcome back to our second part of Helping Seniors of Brevard. My name is Kay Kaiser. I'm the information specialist for Helping Seniors of Brevard County. My pleasure to sit in for Joe Steckler today. He's actually being videotaped for new television shows. As you know, we're on television, radio, print. We try to reach out because our mission is to educate, inform, and connect our callers, caretakers to available resources. So none of this would have been possible, if we didn't have the help of a lot of our partners that are involved with us. That are, folks, when I mention some of these partners' names, these are people in the business, besides our two guests today, that cater to seniors, who treat them respectfully and certainly not going to take advantage of them. There's a lot of different companies out there that just think bottom line, I'm just not going to really do my best. I'm there to make the buck. And the partners that are involved with us I think have a totally different attitude in the fact that they want to develop relationships with the seniors and caretakers in our community. And I'm sure many of them get calls from a daughter or son or a relative that's out of town that wants to look in for resources for what's available in Brevard County, because I know I get those calls. So I want to give a special thanks out to Neuromedical Wellness Center, Pit Crew Roofing, Riverview Senior Resort, Senior Care of Brevard, Senior Scene Magazine. And each month, folks, we have an 8-page newsletter involved in the center of Senior Scene Magazine. So it is a tear-out section, and believe it or not, I have gotten calls from back from 2014. People hold on to that. They may have called me, or they're just finally thinking, I've been meaning to call Helping Seniors of Brevard. And they're finally picking up the phone. So don't be afraid. That's what we're here to do. We're trying to help put you in touch with available resources. And I can be reached at 321-473-7770. We have a lot more partners involved with us, but I would encourage anybody, if you would like to learn more about helping seniors, everything we do is basically archived on our website. And our website is www.helpingseniors.brevard.org. There you can register to actually receive our newsletter and information digitally online. If you don't wish to register your email, go to the media tab, because literally everything we do is archived on our website. Again, that's www.helpingseniors.brevard.org. And if you want to speak and finally think, I'm listening to this radio program today, by all means, give me a call at 321-473-7770. I promise I will return your call. If I'm on the other line, which many times I am, leave a message, because we have a unique system, I believe, in the fact that when our callers leave a message, it's recorded on my computer, it's recorded on Joe Steckler's computer, and Carrie Fink, our director's computer. So we make sure we make it happen. So and that's another unique thing in the fact that you're just not going to get a number by, that's it. Got next caller, next. So we want to make sure we take good care of you and help you out here. So my guests today, Betty Berrisford and Carol Knouse, are with a relatively new home care service called Avid Home Care Services. If you've just tuned in and you missed our first portion of the radio program today, let's start with Carol Knouse. Tell me about what is Avid Home Care Services all about.
Avid is all about caring for people, seniors, anyone who may be ill, someone recovering from surgery, and we provide personal care services, which are hands-on services such as bathing, grooming, dressing, those kinds of things.
Right.
We provide companion care services, which include things like light housekeeping, shopping, transportation, errands, and we also provide what's called respite care. And respite care is something that many people really don't know about.
You're right. They don't know the terminology.
They don't
what
know
is
the
respite?
Yes, right.
I get that question all the time when I get a caller and I say, or a caregiver, and I say, you need respite.
That's
What's
right.
that?
Exactly.
I said, you need a break.
Right.
You need a break.
Basically, respite care, to define it simply, is giving a typical family caregiver, someone, a son or a daughter perhaps, who's taking care of their elderly parents, giving them a break.
Right.
So that they can go on vacation, or they can take care of their own errands or issues that they have in their families. And we can step in temporarily, either for a short term or every now and then when something is needed, because we have no minimum hourly time frames, we can give that caregiver a break, which is so drastically needed when you're caring for especially an ill parent.
Well, I find a lot of my callers that are in that position, they're to a burnout situation.
Absolutely.
Especially, I just got a call a few days ago from a lady who's married to her husband, she is the primary caregiver.
Mm-hmm.
He has Alzheimer's, and now he's starting to get a little bit on the violent side.
Yes.
And I said, I know it's going to be hard for him to have a stranger come in, but if you don't take care of yourself,
that's right.
Then
correct.
You're not going to be able to take care of him properly.
That's correct.
So, it's extremely important that caregivers understand that, or a wife or husband that's taking care of their spouse, because you got to get up. I mean, even if it's just to go take a lunch break, whatever it is.
Meet some friends.
Meet some friends. Do something social for yourself.
That's right.
Right.
It's so imperative because, like I say, there's just a burnout, and too many people wait until they're at that crisis situation to do anything about it.
Absolutely. And it's not just even the care side. There are so many more implications to being a family caregiver. Many times, the spouse or children of someone that they're caring for have to reduce the number of hours that they work, so they become a financial burden.
Right.
They take that on as additional anxiety on top of the services that are being provided, and it can snowball out of control very, very quickly. And the time to really think about respite care is right at the beginning when you decide to become a caregiver for a family member.
Right.
You put a plan in place, and
it's so important.
Right. You know who to call, you know what to do, and you know that you've got to have some kind of relief and some kind of assistance now and then yourself.
Well, Carol, Knouse, wouldn't you agree too, if a family member is involved in being a caretaker for a family member, that you said planning is so important? Wouldn't it make sense to invite a company like yours to have an individual come out at the very beginning, introduce an individual, say, I know there's going to be a point where Dad or Mom, I need a break. So I don't want you to be afraid when it comes to a point where I can no longer do this on a full time. I need personally to take a break.
Right.
So put that up front.
Absolutely. It would make a lot of sense. First of all, it would help the family caregiver with understanding what a professional like an RN, who is what we have come out to do an assessment,
Right.
The kinds of care that are recommended. Our RN also does a home safety check. So
that's elaborate on that.
Yeah,
well, you
sure.
hit the nail on the head when you said home safety check, because people overlook a rug that's there that they could actually slip and fall.
It's not an issue for them.
Right, absolutely.
They don't see it.
Yep.
They, many of our clients are on walkers or some sort of assistive device, and our RN will come out and she'll see throw rugs all over, she'll see extension cords across the floor,
right,
or something that is obviously, a tripping risk for somebody that is a falling risk.
Right.
And many times there are pets or animals that are around people's feet, and it's just so important to have a professional tell you what she believes needs to be done, and to provide. Obviously the purpose of having home care is to be able to allow someone to age comfortably and safely in place.
Absolutely.
And these are the things, and with dignity. And most people are much more comfortable at home rather than going into a facility. And what we try to do is not only provide the top care, but also make sure that they are safe.
That is so important, because I'm sure that when your RN goes in for an assessment, and she may be talking to a lady who recently lost her husband, who was taking care of everything, and their surroundings have been that way for up to years.
Sure.
They're not going to say, well, I never even thought about that.
Right.
Or my kitty cat has little energy here and can dash in front of me.
Right. That's right.
Or even just down to a basic, hey, you might consider getting some grab bars in your shower.
That's right. Right. She
was
looks for those things too.
There was another incident just happened yesterday, which was really could have been critical for the patient. She went out to interview. she went in to interview two RN or two a husband and a wife. Mm-hmm. And when she walked in, she learned that they're diabetic.
Oh boy!
And when she went to check out the house, she noticed in the kitchen it was full of candy wrappers.
Uh-oh.
And she said to them, okay, did the grandkids come to visit? Who's eating the candy? And they went, we've been found. Now, they're diabetic, both of them.
Oh, mercy.
And so those are the kind of things that really you need to pick up on.
Oh, my goodness sakes. They're just doing more damage to themselves than they didn't realize.
That's right.
They're shooting that blood sugar way up there.
Yes, absolutely.
Well, I know, Betty Berrisford, with your medical background and nursing and so forth, to see something like that and know the danger.
That's right.
Unbelievable. They just don't... You get accustomed to certain ways of living. And the kind of calls that I get sometimes, there are planners, which is great. I love those. Mm-hmm. But there are some people that just say, what can I do? I need help now. And I got a call, I believe it was last weekend. She said, I need transportation to the doctor tomorrow. And I said, how long how long did you know you had this doctor's appointment?
3 weeks.
3 weeks, yeah. And I said, well, you did call on a weekend, and obviously any service is going to be closed now, too, unless you call, a taxi and an Uber driver and sign up for that. I don't know. But this is the point. They think, and I have to say, just on the other side of the spectrum, believe it or not, some people as seniors think, well, I've earned this.
Absolutely.
I should be taken care of. Mm-hmm. And I shouldn't have to pay for it. Uh-huh. I've done my duty. I have, paid all that. I'm on a very limited Social Security income. Yep. What can I do? So my name is Kay Kaiser. I'm the information specialist with Helping Seniors of Brevard, sitting in for Joe Steckler today, and I'm pleased to have Betty Berrisford and Carol Knouse, who are with Avid Home Care Services. Are you both of you ladies the owners of this company?
Yes.
We are, and we're sisters.
Well, I figured that.
Yeah, yes.
You both have such a different background. You were telling me before the program went on the air today that you were, financial for Louis Vuitton?
Yes, yes.
CIO.
Yeah, yes, mostly technology.
Wow.
So,
Well, it's interesting how people end up with diverse backgrounds and they suddenly think, wait a minute, the light bulb came on.
That's right.
There's a need. And that need is only going to grow.
Absolutely. Well, we found that with Betty's background, what she does is she's involved more with the client side and with the staffing side.
Right.
And I've taken care of all of the back office. So we wanted to start out with the business in a completely computerized, efficient manner so that we can offer higher salaries to our employees because we have efficiencies in the back so that we can attract and retain a quality of staff.
That's a good point. That's a good marketing too. Very good. And with your financial background, to have, I'm sure everything is documented.
Absolutely.
Everything is documented.
Yes, it is.
So they have a report. Anybody, regardless if it's the companionship to hands-on and help and everything,
Sure.
they give you a report, I assume?
Absolutely.
Okay.
Well, when our RN goes out to do the assessment, she develops a plan of care for the client.
Okay.
And that plan of care might say, a shower on Tuesdays and Thursdays and, cooking on Wednesdays or whatever it might be.
Right.
And then the aid that we send out must follow that plan of care and reports that, those activities were performed. Or if they weren't performed because the client said, they didn't want that today, then that needs to be documented also. We have to have everything documented that we do for someone.
That makes perfect sense. How does a person pay for your services?
There are a few programs that are available for covering the cost of our services. Now, in the what's considered the non-medical home care agency, which is what we are, Medicare does not cover our services.
Right.
Long-term care insurance does.
Okay.
If a client or their spouse, or if they're a spouse of a deceased veteran who served during a conflict period.
During a time of war.
Right, during a time of war, and they just have to serve one day during that period of time. And they
be
did
in the
not,
service 90
right,
days.
That's right. They did not, and they did not have to be in the conflict. They just had to be in during the conflict.
Correct.
There is a veterans benefit. It's a pension benefit called Aid in Attendance.
VA aid and attendance.
Right.
I tell so many of my lady callers on that because
Yes.
they'll call about something
Right.
like transportation. And I say, are you a surviving spouse of a veteran?
Exactly.
You know, so, you know.
And the amount of the benefit is quite attractive, and in
You bet.
many cases can pay for our services for the entire month.
There you go.
It's a monthly benefit that comes out, and unfortunately, it's not well publicized.
Oh, it's a big secret. Let me tell you, because 99% of the ladies that I bring that up to are unaware of
That's
it.
right.
They are unaware.
That's very
That's right.
sad.
I just had a call this morning from a lady. She called me at before 7:30. I'm thinking, let me get my cup of coffee and I'll call you back. But she was saying she can't find her husband's death certificate. She did have, however, his military cards.
Right.
And I said, the first thing you need to do is, I'll give her the number of the VA down in Vera, talk to an officer, and if it'd even be better if you could go in. They don't require appointments or anything.
Right.
But just go in and see, because it sounds like, I think
Right.
she was making $1,020 a month.
Yeah.
So to have that additional benefit, and then
Yeah.
I've had ladies who called me who are surviving spouse who have been taking care of their veteran husband,
Right.
who never even thought. I said, oh my gosh, you've been missing out on all this time.
Right.
That's right.
That's right.
It's so sad, but you're right. It's a big secret.
It is. It is, and we work with a third party company, which was part of the consulting group that we worked with when we got set up, who actually assists the widower, or the veteran to get set up, because in some cases there's quite a bit of paperwork to be done, and there are income thresholds that have to be met.
Sure.
And even if the veteran cannot find their DD-214, their discharge papers,
Right.
our group can help them get that, and can
Okay,
help them
good.
get everything that they need to get squared away and set up.
Right.
And so it works very, very well. So it takes the burden off of them. It takes the burden off of us, and it's a terrific program.
And 9 times out of 10, the surviving spouse is so overwhelmed.
That's
You
correct.
know.
That's
Exactly.
correct. And to have to do all of this stuff and all of this paperwork and
yeah.
everything else, it's much easier to have somebody do it for you.
And you know what else I find too, Betty Berrisford and Carol Knouse, is the fact that many of my lady callers say, my husband took care of all the finances.
Exactly.
That's right. And they have no
I don't
idea.
how
It is
I
so
can
sad.
even find and do this. So now, as a result of that and not proper planning, how does she get herself organized in the right direction? So she's not going to have delinquent bills not being paid, etc.
Right.
So yeah, it's so sad. But the bottom line is, I think it's important. You at Avid Home Care Services, both Betty Berrisford and Carol Knouse, know the importance of planning ahead. And sometimes it's unfortunate we get those crisis calls, and the fact is that at least you don't have any kind of quote contract. You can somebody
right.
can hire
That's
you
right.
for an hour rather.
That's correct.
Let's give your telephone number out again.
Sure. Our number is area code 321-392-3400.
Let's say it again.
It's 321-392-3400.
Okay. Well, Betty Berrisford, do you have any departing comments you would like to tell our listening audience today? We're down to about a little less than 2 minutes here.
Just that we just really want to be in this business just because we want to help people.
Okay.
And that's
Bottom line.
That's the bottom line.
Sounds like
Yes.
you've got a big heart.
Well, I'm a nurse.
Okay. How about you, Carol Knouse?
Sure. I mean, I can't reiterate enough what Betty has said. And one of the things that we are doing at Avid to give back to the community is, as our employees get close to being full-time, where they're billing enough hours so that, they're getting paid enough. We have asked each of them to give us 1 hour a month gratis.
Aw.
So that when we have
Nice.
people who are really need help and who are indigent or just cannot afford our services and they have no other place to turn, that we can actually provide those services. So at a point in
wow.
time when we're up to
That's
15 or 20
Stay in
employees.
touch with me
yes,
on that, will you?
Yes.
that is so important
Yeah.
because the limited, a $600-700 income lady,
That's
I just
right.
don't have the,
Right.
I
That's
don't have the money.
So just to
That's
be
right.
able to come in and give someone a shower for an hour
Wow.
without charge.
That's
and,
special.
And we're not quite there yet, but we're building up to that.
Perfect.
And
Well-
that's what our plan is.
Promise me that you will stay in touch with me when you reach that plateau because I will
Absolutely.
definitely broadcast that out there.
Absolutely, we will.
Absolutely.
Well, again, my name's Kay Kaiser, sitting in for Joe Steckler today at Helping Seniors of Brevard, and it's been a real pleasure to have Betty Berrisford and Carol Knouse, who are owners of Avid Home Care Services. If you didn't get a chance to write their number down, please give me a call at 321-473-7770. Again, 473-7770. Ladies, it's been a real pleasure. You
been
did
a
a great
joy.
job for our first-time radio show here.
Thank you so
It's
much for
been
having
wonderful.
us, Kay.
Yes, thank you so
Yes.
much.
All right.
Really-
Well, thank you. I believe Joe will be back next week. So have a great day and week and continue listening to Helping Seniors of Brevard. Thank you.